going on to our second speaker. Dr. Barrack Alahmad from Harvard University School of Public Health.
Thank you. It's such a great segue because I think someone wrote in the chat about Harvard keeping track of the data that Minwoo was just referring to, and I put the link in the chat as well. So hello, everyone. I am talking to you from Boston, from the Harvard T.H. Chan School of Public Health. And in the talk today, I'm going to introduce you to myself and then to my colleagues from La Isla Network and all the great work that they're doing as showing practical solutions to protect workers from extreme heat and health. So a little bit about me. My name is Barrack. There is another Barrack there, but I have 3 degrees more than Barrack, the other one. But that does not make up the difference in height between me and him. So it was losing the scales of handsomeness, at least to Obama. But I am from Kuwait City. And if you know anything about Kuwait City, you will know that it's very well known for one thing, that is it's one of the hottest countries in the world. So scenes like these, where you see birds just trying to find some shade behind the trees, is very common where I grew up. So that's about me, but I'm going to talk to you also about the work that my colleagues from La Isla Network is doing. And just to introduce you to La Isla Network, it's a global research and advisory NGO, and they conduct data-driven research on occupational safety and health with one premise, actually, that all occupational related illness and injuries, including early mortality, is 100% preventable. So if we keep this idea in our head, that's what La Isla Network has been doing. So you are supposed to hear from Jason Glazer today. He was supposed to give this talk. Jason is the CEO of La Isla Network. He was also selected in the Time 100 in 2024, but unfortunately, you're downgraded to me from Jason. Jason just had a new baby and he's on paternity leave. So I told Jason, I'll do this on your behalf. So let me now introduce you to the global burden of heat and workers. There have been 2 reports from the ILO, the International Labor Organization. The first one said there's about 1 billion workers affected by heat. The other one updated it in 2024. Same organization said, actually, you know what? It's not 1 billion. We think it's 2.4 billion workers affected. And if you see the literature, they will tell you even these numbers are probably conservative. So we think of a large scale of workers being affected by excessive heat at the workplace. Now, before we jump into deaths and injuries, I want to talk to you about before all of this happens. Thermal discomfort. If you're feeling really hot, how does this affect your cognitive function? Here's a study that we did at Harvard, and we looked at the campus allocation for where students, the college kids, get sent to. So some of them go to a campus that has an AC building that they are living in, and others went to a non-AC building. That's a great randomization because that's how the students just go through the system. They give them to this either one place or another. And then they give them on a daily tests that they have to do, like stimulus test and Stroop test, and add 2 numbers and subtract 2 numbers. And look what happens in a heat wave. You see this kind of difference that starts to show up between the students that were in AC buildings and the ones that were not in AC buildings, so that it starts to have decrements in your cognitive ability. And there's a whole list of things that can affect you. This mental fatigue, distraction, irritation, confusion, emotional stress, anxiety, that all of this, you kind of start to feel it. So the question is, does occupational heat is associated with accidents? And this meta-analysis looked at 24 studies and said, yes, actually, when you're doing this hand-eye coordination, you're trying to concentrate and you're thermally uncomfortable, you're irritable, there's a 17% increase in risk of injury, pooled across 24 studies from 6 different countries in the world. But this takes me to Central America, where most of La Isla Network work has been doing. And there are 3 things that are just kind of combining together in these sugar farms. And you don't need advanced epidemiology degree to look at chronic kidney failure and just plot it on a map over places that has high density of sugarcane farms. And they look like this. It's a combination of high heat, heavy work, and insufficient labor protections, things that we've been discussing here. And heat in the kidneys have been getting a lot of attention in newspapers, and in Time magazine put this as chronic kidney disease is poised to become the black lung of climate change. So fast forward to 2017, La Isla Network in Nicaragua, something remarkable just happened is that they signed a memorandum of understanding with a sugar farm in there to start working with them and understand the effects on workers. And the interventions were simple. It's just rest, shade, hydration, and sanitation. It's not rocket science. We're just doing the basics here. But for all the nerds like me, just pay attention now because we measured everything. Heart rate, core body temperature, metabolic rate, cameras, skin temperature, hydration level, urine, environment, everything was calculated. And look at the results. Results are fascinating. So here's what we see. Workers are now getting more rests than they used to be before. And this lunch break that you get. And in here, you see this is the core body temperature that was defined as a dangerous core body temperature, 38 degrees Celsius. And what you see here, more frequent rests resulted in keeping this just below the 38 degrees Celsius. People will say, oh, these are rests. Are you giving me 1, 2, 3, 4, 6 rests a day? Is it a lot? Well, hold your thought. Let's go through the results that La Isla Network has shown through this. Hospitalization for kidney injury across 3 years and 3 harvests, approaching near elimination of acute hospitalization for kidney injury. We get to talk about that. But this compared to some intervention, no intervention, and the Adelante Initiative intervention, just reducing numbers to really important health benefits. But a question that always nails us in the head, I mean, you're giving so much breaks for workers. How does this account in terms of productivity for the employers? Well, let's look at this graph. Remember, we calculated everything. These workers work by the piece, which means that productivity is measured come the end of the day by putting everything on a scale. So we know exactly how much tons of crops that they produced. So they used to work 8 hours a day. Now, with interventions, this kind of dropped to 4.7 hours a day. But look at their productivity of tons per hours produced. And it increases. So more rests actually led to better productivity. And I have people that work in economics, and I don't. I'm not good with money, but others are. And they just put all these numbers like lower staff turnover, reduced absenteeism, reduced accidents, hospital care, etc. There is a 60-cent return on investment for every dollar that was invested in these sugar farms in Nicaragua. And they have the numbers, they have all the numbers that prove it. And I'm trying now to bring this to Kuwait. So this is what I'm doing. I'm trying to get this Adelante initiative and just have it work in a place that is extremely hot like Kuwait. So let me give you this in summary. We've seen four things. There is 23% less work when these interventions happened with all these rests, but kept it below 38 degrees Celsius. With it came 90%, greater than 90% reduction in occupational kidney injury for hospitalization, a 9 to 19% increase in productivity, a 60% increase or return on investment. Plenty of outcomes for the industry as well. You're thinking of liability for a company, you're thinking of strengthening your market position, etc. But for many physicians in the room here, I'll tell you this, many people just kind of get, oh, elimination, that we don't know this. But I'll tell you, in occupational health, elimination exists. In public health, keep vaccines alone. We're not talking about vaccines. But look at brown lung disease. Do you see brown lung disease now? You don't. Why? There were OSHA standards, regulation, regulatory standards for black lung. You're going to hear a lot about this in New Mexico now trying to do something like this. So elimination, if you wire your brain enough to think about this, there's no one needs to labor in the heat anymore. So the Adelante initiative grew to become a center of excellence, got recognition from everywhere. 2024 is continuing peer-to-peer learning. And if you want a happy ending, I don't have a happy ending for you, unfortunately. In 2025, US funding to the Isla Network was got abruptly stopped. All the work in the cohort that have been there also stopped. I want you to show support to the Isla Network. Um, Thank them for the work that they did. I'm speaking on their behalf. This is my time, my last slide. And if you want, you can donate money, say thank you, send them emails. Let's support, let's stand with each other in these horrible times and bring it home and support regulations that affect this. I'm going to stop here.
Thank you so much, Dr. Ahmed. We have a couple questions. The first one is, can you speak to the difference in specific job sectors? Are there certain job sectors that are more at risk and more impacted?
So in,
And sorry,
yeah,
go ahead.
no, go ahead.
Are there others that are leading the way in heat protection?
So when you look at the OSHA regulation, proposed regulation that did not make it, it was announced last summer in July, August. And it showed that the number one industry that they believe that they're affected is construction. Of course, agriculture is always in the picture. That's how the California standards came to life. But number three on the list that OSHA put out there was surprising to me. I mean, I'm a researcher in this space for a while. And can you guess what it is? It's just not something that you think about every day. It's commercial kitchens. It's the indoor spaces as well, which now makes it more important now not to only think about the common obvious thing, or we're working outdoors, or we're working in other places that are commonly affected by sunlight. It's also when working indoors and in close proximity to kitchens and ovens and furnaces and things like that.
Very interesting. Thank you. Another question is, can you describe any barriers you encountered while implementing workplace heat protections with the memorandum?
Right. Number one, employer hesitation. And at the beginning, even with the Isla Network, when they're trying to do this work, there was a lot of nervousness. It's more nerves than it is actually data. And it took some time before the data kind of showed everything that we're looking at. Not just the health, but it's the win-win situation for workers and for employers. Employers will also gain and gain a lot from this. So that was the main barrier. Once that was over with, and employers now are now thinking about this because these farms are now getting better. They're improving, and there is better retention, and workers want to work more in these farms compared to other farms. So they're getting more benefits right now with this. But one thing that is also important is to think about the organizational system. So not only focusing on the workers, because that's really down the chain. There are others like this, supervisors and supervisors above the supervisors, and there's the board and there's the CEO, whatever, of that big company. And the interventions has to infiltrate all levels. And that's where, and you'll hear this from attempts to get a heat standard about training. Training is not just for the worker, it's also for the supervisor, right? So that's how things get implemented at different levels. And in previous attempts where just you only focus on the worker, improve their awareness with a differential power, that does not work. And I've seen this. Most of my work in Kuwait is about migrant workers. You can give them all the training you want. And if they're not empowered to make a decision to say, well, this is a dangerous work site right now, I'm going to stop working, then it's not going to happen. So you have to go above the supervisor and the supervisor above the supervisor and so on. So that's the hierarchical level of training.
Do you have any recommendations for the greatest winning arguments in supporting heat protections with employers around the state?
Right. You'll show them that productivity increases when we get the most objective measure of productivity. the kilos that you put on the scale at the end of the day do not lie. And the workers at the beginning, they used to push themselves thinking that working more and driving yourself because they want to get more and getting paid exactly by how much they produce, that affected how they think about this. But once they started to realize, you know what, if I take a step back, if I rest, go to the shaded area, hydrate, that will show that I can get back at it, get a better focused cognitive ability. And it showed. They put all the numbers together, and it was $60, 60 cents for every $1 spent. So that's 60% return on investment. That's pretty good.
Thank you so much, Dr. Lockman, for being here and sharing your research.